Welcome back to the Neurology channel, your trusted source for all things related to neurology and brain health. Today, we have an important topic to explore. Interferon-beta drugs like Interferon-beta 1A, Avonex, R, and Interferon-beta 1B, Betaseron, ER. These medications are crucial in the field of neurology, particularly in the treatment of multiple sclerosis. Whether you're a patient, a caregiver, or just curious about these drugs, you're in the right place. But before we dive into this, make sure to subscribe and hit the notification bell so you never miss our latest updates. Interferon-beta drugs such as Avonex R and Betaseron R are a key part of the treatment landscape for multiple sclerosis. In this video, we'll explore what they are, how they work, and their role in managing this complex neurological condition. What is multiple sclerosis, MS? To understand the role of interferon-beta drugs, it's essential to grasp what multiple sclerosis is. MS is an autoimmune disease where the body's immune system mistakenly attacks the protective covering of nerve fibers in the central nervous system. This attack on the nervous system can lead to a wide range of symptoms, including difficulty walking, muscle weakness, fatigue, and problems with coordination. How interferon-beta drugs work for patients with multiple sclerosis, MS. Imagine your immune system as an army defending your body against invaders. In the case of MS, your immune system mistakenly identifies the protective covering of nerve fibers in your central nervous system as an enemy and attacks it. This protective covering is called myelin. Regulating the immune response, interferon-beta drugs like Avonex R and Betaseron R act as diplomats within your immune system. They intervene to negotiate a truce and prevent unnecessary conflict. Reducing inflammation. In MS, inflammation plays a significant role in causing damage to the myelin sheath. Interferon-beta drugs help decrease this inflammation by inhibiting the activation of specific immune cells called T cells. These T cells are the foot soldiers responsible for attacking the myelin. Modulating immune cell behavior. Think of these drugs as peacekeepers. They send signals to immune cells, instructing them to behave less aggressively. This modulation reduces the frequency and severity of attacks on your nervous system. Slowing disease progression. Interferon-beta drugs can also help slow the progression of MS. By reducing the frequency of relapses and the severity of symptoms, they contribute to preserving your overall neurological function. Imagine your immune system as a military operation. Interferon-beta drugs are like skilled negotiators who step in to prevent overzealous attacks, reduce inflammation, and maintain peace within your body. It's important to note that these drugs are typically administered through injections, which can vary in frequency depending on the specific formulation, e.g. Avonex R is given once a week, Betaseron R every other day. Patients with MS work closely with their healthcare providers to determine the most suitable medication and dosing regimen based on their individual needs and disease progression. While interferon-beta drugs are an important part of managing MS, they may not work for everyone, and their effectiveness can vary. They can also have side effects, such as flu-like symptoms, injection site reactions, and changes in blood counts. Therefore, it's crucial for individuals with MS to have ongoing communication with their healthcare providers to assess treatment response and consider alternative therapies when needed. In summary, interferon-beta drugs like Avonex R and Betaseron R play a significant role in managing multiple sclerosis by regulating the immune response, reducing inflammation, and slowing the progression of the disease. They help maintain peace within the body's immune system and contribute to preserving neurological function in individuals with MS. Different forms of interferon-beta. It's worth noting that there are different forms of interferon-beta drugs, including Avonex R and Betaseron R. These drugs come in various formulations and administration methods, such as injections, to cater to the specific needs of individuals with MS. Effectiveness and side effects. While interferon-beta drugs have been a valuable tool in managing MS, it's important to understand that they may not work for everyone, and their effectiveness can vary from person to person. Additionally, like all medications, they can have side effects, such as flu-like symptoms, injection site reactions, and changes in blood counts. It's crucial for individuals with MS to work closely with their healthcare providers to determine the most appropriate treatment plan, which may include interferon-beta drugs or other therapies tailored to their specific needs. In conclusion, interferon-beta drugs like Avonex R and Betaseron R play a vital role in the treatment of multiple sclerosis by modulating the immune system and reducing inflammation. However, they are just one part of the comprehensive approach to managing this complex neurological condition. If you or someone you know is dealing with MS, It's essential to have open and ongoing communication with a healthcare provider to determine the best treatment strategy for your unique situation. Thank you for joining us on the Neurology channel. If you found this video informative, please give it a thumbs up. Share it with others who might benefit, and don't forget to subscribe for more valuable insights into the world of neurology and brain health. Stay well and take care.